Hey guys, I'm super excited to be here. My name is Adarsh Mudgill. I'm a dermatologist based in New York City. I'm a dermatologist, dermatopathologist. My main office is on Fifth Avenue in Lower Manhattan, Greenwich Village. I also have a satellite office in Long Island, which is where I am today. And I'm super excited to talk about Chrome. I actually recently became the medical director of Cartessa Aesthetics, and diving into all the devices. I actually have two Chrome devices, one in each of my offices, and it's an amazing, powerful device, and I'm excited to dive into it with some folks who are also getting acquainted with the device and incorporating it into their practices. And I'm really pleased to have Annette Wyckgram here with us, and she's been chroming it up in her town. She's going to tell us a little bit about herself, and we're going to dive into all things Chrome.
Yeah, so I'm Annette Wyckgram. I'm a family trained nurse practitioner here in Denver, Colorado. As far as my background, I have a lot of acute care experience working in the local hospitals here in Denver, and that's kind of where I started a lot of my practice. When I became a family nurse practitioner, I basically went from a medical oncology nurse and transitioned over into internal medicine. And so I worked as a hospitalist for a couple of years in over at Swedish Medical Center. And then I had transitioned over to working as a neurovascular nurse practitioner with radiology imaging associates there. So all super amazing, intense acute care work in the hospital, and kind of had always a passion for skincare and just, for myself. And I kind of started to dabble in that along on the side of working in the hospital. And I started my practice in 2015, Beauty Refined, and just slowly started to kind of grow my own little medical spa. And in 2018, I resigned from my practice at the hospital just to solely kind of focus on my growing business here. So just started out super small and doing aesthetic injections and kind of growing and slowly adding things into my practice. As I kind of grew my practice, I really had to try to think out, just try to be able to treat my patients more holistically and tackle all signs of aging from different avenues. I kind of implemented new technologies into my practice, and that's really where Chrome kind of delivered that piece of it for me in my practice. And so I'm thrilled to have it. And it gives a whole piece of, I guess, here in Colorado, this anti-aging standpoint where people can get no downtime treatments and get better looking skin rather than just kind of focusing on the injectables. So that's just a little bit about me, my practice, and yeah.
Sounds great. Did you have a device before you had the Chrome? Did you have like an IPL or any other technology?
So I started out with an Elos Plus, and so I did have an IPL. It did IPL, laser hair removal, and sublative RF. So that was where I had, that was what's triggered my interest in laser technologies. Was my clients wanted, they were getting IPLs elsewhere, and I was taking care of their injectables. And then I kind of felt like, in order for me, just to better cater to my clients' needs, I needed to incorporate some of these technologies in my practice, because otherwise they'd go find them elsewhere and, potentially get sucked into other specials. And so I think for greater patient retention, being able to get those types of technologies and offer those treatments, become more knowledgeable within that with laser technology in my practice was big. So that was the first laser that I got. And then I sold it when I upgraded to getting my Chrome.
So it's a big upgrade, I would say, and a lot to learn. I mean, I went through it myself, because I had a multi-platform device. I had a It was the Palomar icon, but that Cynosure icon, which is a multi-platform device, IPL and fractional laser. And it's funny, I had both devices in my offices, and I would still kind of like lean on the device that I was very familiar with until like one day one of the handpieces broke, and I was like, all right, here we go. It's time to get the Chrome going. And now I exclusively use the Chrome for, fractional laser, for pigmented stuff, for vascular stuff. And I've actually finally got rid of both my old lasers, and it's an
Yeah.
amazing device. I find it's very different for me actually having a laser versus having an IPL device, just because it's so much more targeted and so much more powerful. And it's
Mhm.
also, one of the great things about the Chrome is, the various applications through their skin apps. So maybe if you could just walk us through some of the things, some of the, the ways you're using Chrome in your office for which types of patients, and maybe I know you have some before and afters as well, so we can kind of dive into some of the the protocols that you use.
Yeah. So just I think with the skin apps with Chrome, it just makes it super easy from a provider standpoint, just because everything's kind of dialed in, and then based on my patients, I can make subtle tweaks rather than having to like get everything set up or all these settings every single time. So primarily what I'm using in my practice with the skin apps is the refresh treatment, the décolleté, and as well as the natural peel. I do have an IPL handpiece, so I offer IPL as well. I do now. Chrome's so amazing, so I'm able to do so many other things in addition, like the vascular tattoo removal. So those are really fun to be able to treat as well. But primarily those three skin apps are hugely utilized in my practice. And here I feel like in Colorado, everybody is healthy and they want to take care of their skin. They want things to be very natural. So being able to have these three particular treatments where they're able to get this like it's minimal to no pain, minimal to no downtime, and then they're doing all these good things for their skin and seeing results is really kind of what is the most amazing about these particular treatments and with Chrome.
Yeah, I agree, but maybe we can actually dive in a little bit more specifically, because I know there's probably a bunch of providers that are going to see this, that they may have an IPL device, or they may have technology that's a little older, that doesn't have the option of using like a skin apps and apps based protocol. Maybe if you could just talk us through like the three that you've been using the most. We could start with the refresh, and maybe just kind of walk us through exactly how you do that with a patient.
Yeah, absolutely. So just to kind of start off with refresh, I think that's a great place to start. So with the skin apps, what we're, and the refresh in particular, we're able to the way that I explain it to my patients or have the conversation is we're combining laser wavelengths to be able to deliver multiple results. We're targeting pigmentation, melasma. We're also then able to stimulate collagen as well, because we're treating more superficial and then a little bit deeper. So with the refresh, there's really two phases or two steps in the protocol. And the first is really targeting a little more superficial in the skin, where we're targeting that pigment. And we do a couple passes of that for the face. And then the second phase where we change the handpiece over, and then we're going a little bit deeper to stimulate that collagen. So sort of an all, more all-encompassing rather than just focusing on pigment, like an IPL, for example.
Right. So which hand pieces are you using?
So I have for the refresh uses the 8, it's like the 8
HC.
Yep, and then the 9.
Right.
So I've got those two, and then the natural peel has its own handpiece that's dedicated to that. And then the décolleté treatment, so treating off the face, it's very similar to, it's the same handpieces as the refresh, just slightly different settings for the neck and décolleté area.
Yeah, it's great. So just kind of like explain to folks what that stuff is. The HC handpiece, it's an 8 millimeter size, it's an 8 millimeter spot size, and it's a 532 pulsed laser. And that really targets pigment very, very well. And because it's like a fractional high coverage, you can really, it's very easy to use and it's very quick to use. With an IPL, sometimes it was a bit cumbersome because this was my experience. My spot size was very small, but like I can fly through a face now. If you just, if you increase, the frequency at which the laser fires, you can really just paint an area like a whole cheek in like literally a minute. I
Mhm.
mean, less than that even. It's amazing. And then with I'm sorry, the 9 millimeter is the HC. The 8 millimeter is the deep fractional, and that basically goes deeper down and it stimulates collagen. Very similar to other fractional technologies, but it's sort of making micropores into the skin, damaging the collagen, which then enables the collagen to reform in a healthier, more robust way. And those two treatments combined, really, it's a pretty powerful punch.
Mhm.
And really, in my practice, I'm a little bit more aggressive, so my patients do have a little bit of downtime. But you really within a week or so, when you combine both treatments, they look amazing, and it's an awesome treatment to stack, every 4 to 6 weeks for several for a package, a 3 pack or a 5 pack or whatever you may need.
Mhm.
But yeah, I'm sure you're probably using it in a similar way.
Yeah, absolutely. And it's interesting too, just kind of getting used to the device. When I like had first started, just even it's interesting to follow my patients, and I'll have very similar skin types, for example, and somebody may be red, they'll leave the office and be red, up until about bedtime, and then they're like the redness was gone, and then somebody else may be red until the next morning. And it's really just that like sun kiss, a little bit of sunburn,
Yeah.
nothing super aggressive as far as their redness. But they're also very comfortable. It's like, you know, I would say my clients say that it feels less snappy. It's pretty minimal as far in comparison with like an IPL,
Yeah,
where
it's great.
it feels a little bit more of a pinch.
Do you use a Zimmer or do you use a cooling device, an external cooling device?
I do have a Zimmer. Well, actually, it's a Sub Z. Sorry, not a Zimmer. I use my Sub Z mostly for the tattoo removal treatments. Everything else, everyone's pretty much kind of handling it, you know, minimal to no pain.
Yeah.
Um, but
So
the
talk to me
Sub,
about tattoo removal. Is that something new that you've incorporated into your practice, having the chrome?
yeah, I never honestly thought that I would be interested in doing tattoo removal, but now my patients will hear that somehow it'll come up in conversation. They're like, oh, it does like tattoo removal. I've got a couple tattoos I'd love removed. So it's actually it's very kind of satisfying, and it's fun to do as like a provider to treat. And then, there's really no downtime with the tattoo removal. I mean, some of my clients report like a little itching post treatment, but that's pretty short lived. And then the amount of fading of their tattoo is pretty good with just, even just 1 or 2 treatments. So I haven't gotten quite full, like through 8 sessions, to see full results on my tattoo removal clients yet, but that's kind of a new thing that I am implementing with my chrome in my practice.
Yeah, I love that. It's funny. I used to do a lot of laser tattoo removal when I was a resident, and my New York City office is my first office. It's a very small space. I couldn't really have a lot of devices. So that's why I kind of went with a multi-platform device initially, and I didn't have any way to remove tattoos. So I just didn't do it for like a decade. But now it's something which it's awesome, like reincorporating it back into my practice, and it's
Mhm.
actually pretty amazing. Like the before and afters with the chrome are like incredible for tattoo removal. So
Mhm.
I have a bunch of patients lined up for that. It's really exciting to have that. Like I said, it's a very, very powerful device with a lot of applications. And I think anyone who is looking for like a multi-platform device that's more powerful than some of the other devices that are out there, and with a lot of like the skin apps and just a lot of built-in technology, which makes the interface very user friendly. Obviously,
Yeah,
you're
I think that's the biggest thing for me too. It is very like from a provider standpoint. it's very user friendly. And, it's even just looking at the manual, for example, if I want to do scar rejuvenation, it's very straightforward. It's easy to dial into the machine. So, and like you say, it's very powerful, and it's a pretty amazing device for those reasons too.
Yeah. So I know we have some before and afters. Should we go through some of those?
Yeah, that'd be great. Okay, so this is a patient of mine who we did a natural peel treatment on. And so doing this treatment is really fun as a provider, but clients love it for the fact that it really gives like glowing, radiant skin. I love to, when I talk about this particular treatment to my patients, it's basically like your red carpet. Like, I want glowing, radiant, event looking skin. And it's this patient, you can see immediately before on the left, and then immediately after her treatment. So it's almost like you can see this brightness in her skin, a natural highlighter, so to speak, where now she doesn't have to go ahead and use her makeup to put that on because her skin is just glowing. So it's really neat because you can see that even just immediately after, it's kind of gives the skin a nice bright glow. It reduces, the pore size is reduced. And then it also has, so this particular treatment is a 3-step process. So we're using an organic bamboo mask that we do apply to the skin. And then we are kind of heating that up and warming that up with the laser, and that allows it to soak into the pores of the skin. And then we use the laser to remove it. And then we finish with a warm laser treatment to help with the collagen stimulation. So again, another one of those treatments where it's no downtime, collagen boosting, and then making your skin kind of look glowy and radiant.
Yeah, it's so the pictures almost don't do the natural peel justice. Like, you can definitely tell in these pictures, but when you see it on a person, it is really crazy. I did one on my assistant, and I was like, when she was done, I was like, oh my God, like, your skin is like literally glowing. And it was like that for days. Like, I think when you heat the skin, it's a perfect like pre-event procedure to do, because it really legitimately makes your skin pop. It would be great before like a wedding or before a party or before like a red carpet event, or somewhere where you're going to be in the public eye, because it reduces pore size, your skin glows. It's a really fun procedure, like you said, from a provider standpoint, and for someone who's very involved with social media, it's like the best Instagram post that you could possibly make.
Absolutely. It is. It's very satisfying taking that mud mask off.
Yeah.
And then, just checking in, especially when I was first starting this treatment in my practice, checking in with my clients, like later that day or the next day, the feedback literally was like, my skin is glowing, just like you said it would be. So it does exactly that. So this treatment's amazing.
Yeah, it's better than any chemical peel. It's better than anything else I've done. I used to do chemical peels like before, like, series of peels before someone's wedding or before their bachelorette party, and my line would be, this is the procedure you do to give your skin some pop. Like, I probably will never do another one of those again, because this is so much better.
Oh, 100%. I agree. And then just, that organic bamboo mask has all these growth factors and antioxidants in it too. So they're getting really great ingredients kind of infused right into their skin and pores there.
Let's keep coursing through these. Let's see what we got next here.
So this is just taking a little closer look because, like you mentioned, sometimes the photos it's different in person immediately after the natural peel, because it's sometimes hard to represent exactly what you're seeing in person, but you can see her skin's just brighter, right on the bridge of her nose, under her eyes, her chin area. So
yeah, looks great.
This is another natural peel treatment. Again, you're just seeing like an improvement of her skin texturing. smoothing of her fine lines and wrinkles, especially looking at her forehead there in the glabellar region. Really just if you kind of break down each area of her face, you can see from before and after, just that her complexion's overall better.
Yeah, that's a great picture. That actually does capture that. It's literally that dramatic in person.
Mhm.
It's pretty remarkable. And I think a lot of it is that last phase where you're heating the skin.
Yep.
Just you get like a little bit of edema, I think, in like the in like the very superficial part of the dermis, and that really makes the skin pop and reduces pore size. So
Mhm.
it's a perfect pre-event treatment. I can't imagine another treatment making the skin look better.
Absolutely.
Yeah, that's amazing.
Yeah. I mean, those pores and the lines
Yeah.
are nearly gone. So,
And again, I think folks should realize that the results for these types of results are transient. Like, the patient will kind of revert back to what their skin was in, in probably like a days to a week. But it's
mhm.
also that's for that reason, it's a great procedure to kind of stack even like, like you could do these once a week, you could do it once a month, you could do it once every 3 weeks. You could
Mhm.
kind of space it out for a patient to kind of maintain that really beautiful glow to their skin.
Yeah, I've been pretty much implementing. I mean, I think you're right. You can really do them as frequently as every week. But about 3 or 4 weeks is what I've been recommending in my practice. As far as when I'm kind of talking to them about whether, I mean, I think when they do one, they're like, that was amazing. But when to kind of put together a package treatment, spacing them out about every 3 to 4 weeks, I think is a really great way to just kind of give the skin a nice boost.
Absolutely. Oh, that looks familiar.
Yeah.
Yeah, this is actually my assistant that I was talking about. This was actually the first natural peel that we did. And it was a lot of fun. We recorded it, we posted it to Instagram. But yeah, I mean her skin was literally glowing.
Face is because it like tickled. It's
Yeah.
weird.
Or the sound.
Yeah, like the one by my ear,
Yeah.
I wasn't expecting. My face is red just from brushing my teeth.
Yeah.
I feel fantastic.
So that's my assistant, and we did a natural peel on her, and our technique has gotten better. It was the very first one we did, so we were a little clumsy with like getting the cream to look, getting the activator to look super super smooth. But
Mhm.
in any event, I mean, she was red right after the treatment, to be expected, but that faded within a matter of minutes. And the next morning we were driving from New York City, from Long Island to my New York City office, and it was amazing, like how incredible like her skin looked. I was like, wow, because a lot of like these treatments, they really, there's a lot of claims out there that, oh, this is going to make your pores smaller and it's going to make your skin radiant and you're going to really smooth your lines, and that's kind of like the party line. I've never seen something actually deliver that. Again, like I said, this is something that you would have to stack and just to kind of maintain those results. But it was pretty remarkable. I mean, I was just sold on it after seeing how amazing my assistant's skin looked.
Yeah, I know it is. And like you mentioned too, like if they're a little bit red right after, it does dissipate within just like a few minutes. And then their skin's just glowing.
Yeah. I think we also have some before and afters of just some of the other skin apps that you're using.
Yeah. So we
We
can,
can continue on to those.
yeah. Okay, so the refresh, this one is a big one in my practice that I do. So here with this particular treatment where, as we talked about before, we're treating more superficial to target that pigmentation, whether that be, hyperpigmentation from age spots, sunspots, that kind of thing, melasma, and then treating a little bit deeper down for that collagen boost. So this treatment, she purchased a package of 4. And so the photo on the right is her after, this is after her 3rd refresh treatment. And she didn't even, it was probably about a week after her 3rd refresh. So I don't think are seeing even the full results after her 3rd one. But, overall, she suffers from rosacea and that redness. So that looks remarkably improved. Her area of concern too, amongst the redness, is the fine lines. So right in her glabella area, you can see that line is softening. Even some of the other lines, like her mental crease, the line above her lip. And I think we have some slides that will show those a little bit. Yep. So one of the biggest feedbacks too that I'm getting from my clients after even after one refresh treatment is they're getting compliments from other people on their skin, like your complexion is looking better. Your skin is like, from their estheticians are telling them their skin and texturing is smoother. And then overall the pigmentation is more muted, and that starts to improve as well. So we're really tackling so many things with this treatment, from pigment to pores and texture, minimizing the fine lines and wrinkles. So when I think we've got a couple more here's that one looking at that glabellar line that is softening up. Even the one on her nose, you can see her pigment and texturing of her skin is smoother. We can look at that. Yep. And then right there, you can see her mental crease. I feel like that line is softening up, even the one over her lip. So everything's just, she's getting an amazing glow from this treatment as well.
So the refresh, just to remind folks, it combines the superficial, the 9mm HC and the 8mm DF, correct?
Yeah.
Do you use an IPL with this or no?
I haven't. No, I'm just doing, it's just the 532 nanometer wavelength, the 8 and 9 hand pieces. And that's pretty much it.
That's pretty amazing, because even her rosacea looked a lot better.
I know. I was pretty impressed with that. So she's thrilled. She is thrilled with her results. Here's another refresh treatment, and same thing. I'm not the rose. This gal doesn't have rosacea, but looking at her pigmentation, you can see that her complexion and those age spots the dark spots are faded, and her fine lines and wrinkles are faded here as well.
That's great.
Yeah, so zooming in, you can see that texturing under her eyes, amazing. Her skin looks plumper. The lines are not as deep, and that pigment is really fading.
That's pretty remarkable.
And here again, those glabellar lines are improved, and that pigmentation on her forehead, you can kind of see that too, getting better.
Yeah, looks great.
Yeah, again here, like even with this refresh treatment, like looking at the texturing, I think this is a really good one to see, like on her chin, like it just looks smoother, aligned with the lines being finer, the pigment, that tone and texture is looking really nice.
Yeah, looks great.
And so like the refresh, this is just bringing it down off of the face. A lot of my clients, I feel like, tend to forget about their neck and chest. And that is an area that I think, because they don't think about it, they're not putting they're not focusing on SPF in that area as well. So a lot of people end up getting pigmentation on their on their chest and neck, and it's just such a delicate area. So I do a lot of education in my office about, we need to be more conscious about taking care of these areas and using good products. And one thing that's really nice is before it was just a medical grade skincare neck product or décolleté product that I was able to offer them. Now I can offer them this like no downtime, amazing laser treatment to really help boost collagen in this area and then help improve skin texturing and fading the dark spots, fading the fine lines and wrinkles in that on their chest. So looking at that, you can really just see the pigment is definitely faded. So this has been a really nice addition to my practice to be able to offer to my clients.
So are you using an IPL? Is IPL the first treatment here, or is it the same? Those are the same two hand pieces that we just.
So it's basically the same. It's just bringing it down. So the settings are just slightly different. And then I'm adjusting those based on, so it's nice because my app on my skin app, I just click on the décolleté. My settings are already pre-programmed. I usually kind of have my sweet spot settings that I start with, and then based on how my patients are reacting, I dial those up as we go on with subsequent sessions as well. But I'm not doing, I will obviously do IPL if they're not wanting to do refresh. I haven't combined the IPL with the refresh because the refresh and or the décolleté are already kind of with that 532 nanometer wavelength handpiece that we're using. It's helping improve their pigment from just using those handpieces alone.
Got it. What about vascular stuff? Are you using the YAG handpiece?
I am, yeah. So, the little telangiectasias, the vascularities around the nose. I am using that primarily just on that with the face. I haven't really tried or dabbled into a lot of other vascular stuff right now in my practice.
Yeah, amazing. I was actually doing a patient yesterday. I was lasering vessels off her face, and I was lasering pigment off her face. She said, I have all these leg veins, and she said, can you laser? I was like, yeah, actually, you know what, I can. And I went down and I just started, just literally tracing some veins on the lateral part of her thigh that have been bugging her. They've been there since she was like a teenager. It drove her nuts. Literally melted them away. It was the coolest thing. I wish I videoed it for Instagram. It was just awesome, just kind of tracing the vessel down and just completely gone. It was really wild. So it's exciting because I hate doing sclerotherapy. It's just something I just hate doing because it's no fun. It's very tedious. It's never amazing results. And that's something I'm super psyched about, to have the chrome to be able to offer my patients.
Yeah, I haven't gotten myself into sclerotherapy either. And I would probably agree with you. It's just not, we all kind of have certain ways that we like to do things. And it is really nice to be able to have a laser to tackle those kinds of little vascularities.
Yeah. All right. So just to kind of wrap things up here, because I know a lot of folks that are watching this either have a chrome and want to learn more about how to optimize it in their practices, or are looking to add a device to their practice, and are not sure how technology like this could help them with their patients, which we discussed, but help them with their bottom line. So maybe you could talk to us a little bit about, what you're offering, how the kinds of packages, kind of getting more into the business side of having the chrome in your office, and, just any advice you have for any clinicians out there that have this technology or thinking about adding it.
Sure. Yeah. So I think obviously I think part of this is going to depend on your area. The way that I started looking at it was, it's great to get somebody to purchase one treatment where, for example, my refresh treatments, I've sort of priced them out to be comparable to what I'm using for the Virtue, for example, with radio frequency, and kind of comparing that. So one treatment I sell for $9.50, and I include a little post-treatment care kit. But doing one treatment, it's really nice to be able to have your patient committed, and they're going to get better results if they're going to be having subsequent sessions, or if you kind of get them geared into doing a package, for example. So for me, the way I thought about it was, if I offer a refresh treatment for $950, if I can get them committed to a package of 4, the way that I've advertised it in my practice and has been successful is to sell it for, basically I'm advertising as buy 3 and get 1 treatment for free. So then if you think about the breakdown of that cost spread out, they're paying about $712.50 per treatment. So if you break it down that way for your client, they are kind of like, okay, I'm getting a much better deal if I buy a package. And then as a clinician or provider, I know that they're going to get the best results or outcome when they're committed to doing a package treatment. The way that I'm selling my décolleté is as an add-on for the refresh. So I'm adding that on for like $300 of treatment if they're buying a package. And then I kind of just break up the math that way. And then with Natural Peel, it's $400 for 1 treatment session, or if they buy a package, they could buy 3, get 1 free. And so then it breaks down to $300 per treatment. So $1,200 for a package of 4. And as far as, with the tattoo removal, that was somewhere, that Cartessa had guided me in helping me with price points for some of those treatments. But I break those down. I just think about my time, how much time I'm going to be in the treatment room, doing the laser treatment, and then figuring that out. So if it's a small little tattoo, I'm charging like $150. And it really just takes me, that appointment's probably 15 minutes at the very most, to where there are, depending on the size of the tattoo, I just break that down, $150, $250 for a medium size, or $350 for a larger tattoo. Same thing with, IPL in my area, I charge $350 a treatment, or again, try to sell a package. And that's where I'm doing, usually I try to do maybe anywhere between 15 to 20% off if they do a package treatment. So that's how I'm kind of breaking down my pricing as far as Chrome. It's been, I think it sparked a lot of interest in my clients, and I more often than not am selling a package versus selling an individual treatment.
Yeah, which makes sense, and I like the way you put that. It's the patients are getting a value by buying a package, but you're also ensuring that they get an optimal outcome, because a lot of times just one's not enough.
Mm-hmm.
Yeah, that's a great way to do it. So anyone who's thinking about adding this, sounds like it's been a home run for you in your office.
Yeah, it's been great, because now I just feel like I can now treat my patients from so many different perspectives to target, their anti-aging goals. And, I'm not only focusing on just their the toxins or with fillers, I'm getting them to think more on, aging is a constant thing. We're constantly aging. And by, incorporating other modalities, whether that's our medical grade topical skincare, doing microneedling, incorporating laser. And then I just have these discussions with, can we afford some downtime or not? And I think that that's where the biggest home run or winner is for me with Chrome, is I'm able to deliver these collagen boosting, pigmentation reducing treatments with little to no pain and little to no downtime.
Yeah,
it's been awesome.
That's amazing. Well, thanks so much for sharing your experience. I think this is gonna anyone who's on the fence or just wants to learn more about the Chrome, I think there's chock full of information there.
Yeah, and I'm always available if anybody has any questions about it too.
Awesome. All right, so anyone who wants to learn more about the Chrome technology, it's exclusively brought to the United States from Italy, where all the best lasers are made, by Cartessa Aesthetics. And if you want to learn more about the Chrome device or any other offerings that Cartessa has, you can visit their website, cartessaaesthetics.com. It's chock full of information. and you can learn all you want about the Chrome device. The last thing is, if anyone wants to ask any more detailed or specific questions about Chrome technology, about skin apps, about settings, about business related questions, it's anything related to this device, you just click on the link below and that'll take you to a question and answer portal. You submit your question and someone will get back to you with a very specific answer.